Good evening. Today, the Ministry of Health has launched the Lab Sector Performance Report, looking at how many labs are accredited across the country, how the lab sector has performed, but also they have launched DNA testing guidelines. Joining us is Dr. Susan Nabadda, the Commissioner in charge of lab services at the Ministry of Health. Good evening and welcome to NTV tonight.
Good evening.
Today you've launched the sector report. What's the status of the labs in the country?
We have a tiered laboratory network that has national reference testing laboratories that include the Central Public Health Laboratory, the National Microbiology Reference Lab, the National TB Reference Lab that also doubles as the supranational reference lab in the region, the UVRI, Uganda Virus Research Institute, Makerere Lab, JCRC labs in academia. That is the capacity that we have at the national level, but we also have a capacity at the sub-sector level, sub-national level that includes the regional referral laboratories, includes the district hospital laboratories. The laboratory testing goes up to health center 3 as we stand, but we also have the community aspect where we reach out to the people in the community to test them. As we stand today, we have 70 laboratories accredited in the country that include both public, private, research labs and academic labs.
When we look at most of the funding, it's from partners, and it's funding mostly malaria, TB, and I think COVID-19. Where does this leave other diseases? For example, maybe sickle cell. Do we have enough funding to cater for others, or do you feel like there are still gaps?
Yes, there are still gaps as we stand, and as today's theme is rethinking the investments that we've had for those 3 diseases you've said, to leverage on them to do other diseases that are underfunded. As I clearly stated that some of this equipment and the human resource and the infrastructure that we have can be used for the other diseases. The issue is to increase the funding in terms of the logistics, the supplies to be able to do this. But we are leveraging a lot. For example, the gene expert currently, that was for TB, we can be able to do other tests like cancer, like COVID. So we are leveraging on that. As we said, we've noticed an increase in the funding. The gap is still there. We are at around 70% funding, and we've noted increase in funding from the government. So we are advocating, the top leadership is advocating to have more funds coming for the other areas that are not funded. Good enough, we know the need, we've quantified, and we are using it as an advocacy tool to fund. And as you heard the permanent secretary saying that we've moved from 11 billion, now we are at 50. So slowly we shall get there.
Let's talk about DNA testing guidelines. DNA had created a lot of havoc early this year.
Yes.
What is in these guidelines in terms of sample collection, and what are the key guidelines when it comes to the DNA testing?
DNA testing, like any other test, we really want to control the quality of the result, because we know the implication of giving you a result that this is your child and is not your child. So we start controlling right from the person who collects the sample. We need to know that. So the guidelines include both people who want to collect and take to laboratories that are certified to test. So those are sample collection site guidelines. Guideline is around the technical competency of that lab to be able to put out a quality result. Do you have the human resource able to carry out this test and interpret it? The right machines, because it's not that every lab can do this. So we come and assess, because we know the process flow of what we really need to use to test for DNA, the interpretation of the results, the custody of the results, the data management of the results for the side of the labs, but also chain of custody of this sample from wherever it came from.
Thank you very much, Dr. Susan Nabadda, the Commissioner in charge of lab services at the Ministry of Health. I am Nobert ATUKUNDA for NTV tonight.